So the most common condition that we see is a herniated disc. This can usually be in the cervical or in the lumbar spine. So a cervical herniated disc will cause a combination of a neck pain with arm pain or arm weakness going down one or both arms, whereas a herniated disc in the lumbar spine will cause back pain with leg pain or leg weakness also. When patients come in, our first goal is to make the diagnosis. Sometimes we will get x-rays, some patients may need an MRI scan, and usually that will help determine exactly what the problem is. On physical examination, different muscle groups and different locations of pain can clue us in to where a disc herniation may be. Some people may present with one herniated disc, some patients may present with two or more, and that can make the symptoms worse also. Younger people tend to have one bad level, whereas patients as they get older and have more degeneration in their spine in general will have more than one level involved. The diagnosis of a disc herniation starts with a conversation. Just in talking to the patient, a lot of times what they say will tell us what the problem is, the activities that make the problem worse, the positions that they have to get into to eliminate the pain, the activities that they've given up in order to minimize the pain that they're feeling. All of those things will clue us into where the problem is. Once the history is done, we'll examine the patient and look for weakness or any sensory issues. If there's numbness or tingling, we can pick it up at that time also. Usually the patients will have either x-rays or MRI or both. We will review those together and I'll show the patient exactly what's wrong.